This is Dr. Jeff Starr, and I'm here to tell you a little bit about my billing company. We're family owned and operated. Several of my kids work with me, in addition to my wife. We started this billing company basically because we felt that a lot of other physicians in our community, and from our previous experiences when we had someone do our billing, were not really getting a fair deal with regard to the cost that they were paying for the services that they were receiving. We feel we do a very good job, and hopefully the information I'll present to you in this brief slide presentation will bear that out. As you may know, most billing companies will charge based on revenue collected. This usually amounts to a fee of 5 to 6%. Back in 2011, the collected revenues from my practice were a little over $425,000. The billing company was charging me a little over $25,000. It often made me wonder how efficient they were in their collections, how much money was not being collected. I had a very difficult time tracking that down since I had no information from them regarding the actual billing that was being done. That's when I had my daughter start to follow what they were doing to learn the billing process herself. We have developed a very efficient medical billing system where we're able to charge a flat fee per claim of just $2 for regular medical claims and $3 for claims that require transmission of medical records. We are able to do this because of a system my daughter developed. She's very meticulous and very efficient, and so we're able to generate claims, submit them to the clearinghouse and subsequently to the insurance company, follow those claims up, resubmit secondary claims or mistaken claims, follow up phone calls. We can also provide assistance in managing accounts payable, but we have a collection rate of 99.986%, which basically means we missed about 5 claims of the past 37,738 claims. Now, those 5 claims that were not paid, 3 of those were my fault. I submitted the data to my daughter after the 3-month time frame for some private insurance, and the other 2 I believe were workers' comp claims that we were not the primary physician on that claim, so we had difficulty getting payment for our services. The rest of the claims that we've submitted, we've gotten paid for. So in other words, if you've done the work and provide us with the proper information, we will get you paid. We also have this unique color-coded system that will allow your staff to see outstanding balances and missed co-pays as patients come to your window after a previous visit. And this list of outstanding balances is updated on a weekly basis. We typically feel that we could save a average family physician anywhere from $3,000 to $7,000 a year over their current billing. If you have a busier practice, we're going to obviously save you more money. From the example I led off with from my practice from 2011, I had a 6% billing cost. During that year, I submitted 5,837 claims through the billing company. So my cost per claim was $4.37. So as you can see, our cost per claim is substantially lower than that. If your practice has large dollar amount claims like heart catheterization, surgery, you're going to save even more. So once again, if you look at my practice from 2011, and if you take an estimated cost per claim of say $2.50, that would mean that half the claims we'd be submitting for my practice will require extra documentation, which was not the case. But let's just say the average cost that we're going to charge you is $2.50. On the same 5,837 claims, the cost would have been $14,592. That would have saved me over $10,000 a year in billing costs from the previous billing company that I had. So this is basically a breakdown of our fee schedule. We have a flat rate billing fee of $2 per claim, no matter how much work it takes for us to get that claim paid. There's an additional $1 per claim that requires transmission of medical documentation, which you, of course, will provide to us. We use a company called BillFlash for our statement generation, and if you do paper statements, they're 75 cents a statement. Electronic statements, in other words, sending a bill to people through their email, is 25 cents. And the BillFlash also has an address lookup for 17 cents per address. It's come in real handy for people that we all of a sudden can't find their address for some reason, or they move and don't tell us. The BillFlash cost for my practice currently is right around $100 per month to send up follow-up statements. So if you're busier than I was or am, or less busy, you can kind of estimate that cost in. The TriZetto clearinghouse that we use is free. TriZetto is a company that bought out Gateway Clearinghouse. You might be familiar with that name. And we've used them for a number of years, and they provide excellent service and great claim transmission. So if you have further questions or would like a quote from us with regard to your practice and how much it would cost for us to provide your medical billing service, please give me a call on my cell phone. It's listed on the slide. It's 330-312-1966. Or you can send an email, fax us, or visit our website and contact us through there. We're really looking forward to hearing from you. We'd like to be able to provide you excellent medical billing service at a low cost. Thanks.